It was a very important meeting which called for by the Honorable Prime Minister Ji, and it was a top people who are involved in the healthcare delivery system had a time to interact. It was a pleasurable moment as the Honorable Prime Minister was so kind enough to listen to all our inputs and taking notes of it, and he was assuring at the end that it is with your inputs and definitely we will be able to overcome this corona pandemic. And he was so positive on that. He has called all the doctors to be positive. And one of the very important thing which he has emphasized was all the senior doctors should see to that you are training your colleagues and the junior doctors and always taking care of them, motivating them and helping them to encourage in the active role in the healthcare delivery system. He assured us to streamline the shortage of the drugs, and he was assured that he will specially look into that and ensure the supply of the drugs and supply of the oxygen will be streamlined and it will be made available to the country. He thanked the medical fraternity and all the healthcare delivery system who has participated and encouraged them to actively take part in the continued war and continued struggle. And the entire people, on behalf of the people who have participated and on behalf of the Indian Medical Association, we profusely thanked our Honorable Prime Minister for initiating the vaccination drive in this country. It was his decision that could only help the India to enroll and roll out this vaccination. We also brought to his notice the shortage which we are envisioning in the manpower. As the examinations for the postgraduate entrance examination is not held, we brought to his notice that 1,78,000 doctors are there preparing for this exam. So we have asked him to expedite the exam at the earliest so that these people can join as a postgraduate and the junior doctors in the healthcare delivery system. We also talked about the decision of pending FMGE, foreign medical graduate, and we have appealed to the Honorable Prime Minister to take a lenient view and take role of this foreign medical graduate into the medical healthcare system. And we are also happy that other system of people, Ayush people also participated. They also assured their full cooperation in the healthcare delivery system. And I am confident by this meeting as it has enhanced the morale of the healthcare professional, and it will definitely, they will take part very actively and ensure we will be trying our level best to overcome the second wave pandemic which is scraping the country today.
Well, that's very good to hear, Dr. Jailal. So you're saying that the Prime Minister was very receptive. So this is a big breaking news update. The Prime Minister was receptive, and you spoke about the vaccination program as well. What was discussed on the vaccination program? What was the feedback? Along with you, Dr. Jailal, I saw some of the other experts there. Very happy that, you know, because I know what you would have told him, because we've reported here on Republic TV. You've come live on Republic. In the past, you have spoken about the vaccination program. You've also written to the Prime Minister in the past. What was the the view of most experts? Why don't you tell us a little bit about that? What was the thought of all these experts? What did they share? If you can please tell our viewers, because there's a lot of interest among viewers on what happened in that meeting, because whatever happened there will be discussed with the pharma giants next. And that meeting, we believe, has begun in the national capital. The Prime Minister is meeting vaccine makers. Tell our viewers, Dr. Jailal.
Yes, it was a meeting in which we were able to share on the views that how one of the most important thing emphasized is the COVID appropriate behaviors. And many experts has emphasized the Honorable Prime Minister to lead from the front and make a call to all the people to appropriate behavior of the COVID, that is wearing the mask and keeping the distance. And we have requested our Honorable Prime Minister to lead the campaign from the front so that his words will be taken very importantly by our honorable people of our country, and that will be a very positive impact it will create. That was Honorable Prime Minister accepted that with the grace, and he has assured that he will definitely emphasize on this into the entire community. The second issue which we have discussed about whether we need a lockdown at this moment, there was some difference of opinion were there. And some of the experts, including Indian Medical Association, we feel because lockdown will be not only for the curtailing, the breaking the chain, it will always give us time to empower and recoup our infrastructure and the supply of the drugs, and everything can be in a way it will be able to be recouped. And some of the consultants, some of the leaders felt that lockdown may bring in economic burden,
yes.
So it may not be required.
Oh, that is big breaking news update, Dr. Jailal. That is a big breaking news update. You're saying that there was a difference of opinion on lockdown. That is a big breaking update. Sorry, go ahead. That's a big update. I just thought I'll just emphasize that. Go ahead, sir.
Yes, I think now, indeed, that is a very 2 points of view. Why we are saying lockdown is not for the completely locking down, but it will give us time. The inflow of the patients, the inflow of the certain exponential growth will be, there will be a break will happen. By that time, that utilize that time to recruit ourselves, to enhance our power, enhance our manpower, enhance our infrastructure to the maximum level. But other point of view, which is expressed by the some of the doctors, fighting lockdown, the economic burden will be increasing, and the people will be even resistant to come for the vaccination. The people at need of the medical care may not be able to reach the hospital. But now the government has to take a very important decision on this. But what all of us felt, that is a small curfew, like putting a curfew between 10 o'clock to 5 early morning, 4 o'clock, is not going to be of use. It is going to only add the congestion in the daytime. So let us do, if at all we are planning, let us plan for a lockdown in a sustained way and in a way in a well-guarded way that we done.
Oh, that is a very big breaking news update, and that's the trend that we are seeing across India, Dr. Jailal. Most states are imposing this mini lockdown. In Delhi, it's not a complete lockdown; it's a mini lockdown. So you're saying that the overwhelming view of these experts was to impose smaller curfews. Is that correct? And did the Prime Minister respond to these suggestions? Did he have to say anything on that?
So, Prime Minister has assured that he has to discuss with his further and take a decision, and he has not announced any decision at that moment.
Yeah. What was his message? His overall message to the medical community, the medical fraternity? All of you very renowned senior experts were part of that meeting. What did he have to say to all of you? What was maybe let's say the 4 or 5 top takeaways for you from there?
It was a positive feeling. Prime Minister present was really encouraged and empowered the medical fraternity today, and he has thanked the medical fraternity for their human service in curtailing the first wave, and he has appealed to the medical fraternity to come positively on the second wave. That has definitely stimulated, empowered, and encouraged the medical fraternity. And he has assured that he will be with us in all our needs and all our suggestions. And that was a great moral boosting. I feel this is the one moment the Prime Minister has spent the time with us. It gives a moral boosting the medical fraternity across the country, and we will be able to participate with more vigor and more energy, so that definitely we will be aggressively participating in this campaign against the COVID, and we will be succeeding in this also.
That's fantastic. In fact, let me also tell you that we had some bit of breaking news coming in, so I just want to tell that to our viewers before I take the next question with you. The Allahabad High Court a few minutes back has ordered lockdown in 5 cities of Uttar Pradesh, including Kanpur, including Lucknow, Varanasi, Gorakhpur, Prayagraj, 5 cities where the court has had to intervene and said that the lockdown must be imposed. So that's a little bit of a breaking news update. And Dr. Jailal, who is the president of the IMA, was part of that meeting with the Prime Minister. And Dr. Jailal is telling our viewers that there was a difference of opinion on imposing a lockdown. Dr. Jailal, like we've seen in the first phase, lockdown can have adverse effects, and you mentioned that about the economic impact most importantly. And was that the overarching medical view, that a limited curfew-like situation with restrictions should do the job?
What we personally feel and the medical fraternity
is the curfew which is imposing for the few certain hours, say from 10 o'clock in the night to morning 4 o'clock or 5 o'clock in the morning, is literally not going to stop us and help us in the break the chain. It will only affect the small and the street level merchants and the workers, and it is going to affect them. It will not create the break the chain. And if we want the break chain, it is not a cyclical one. It has to be a continuous one. If you are ensuring a lockdown continuously for a week or 10 days or 20 days, 2 weeks, and that will be ensured there is a complete breaking the chain of propagation of the disease will happen. But instead of that, instead of curfew, and another option will be isolation, it's a selective isolation and containment of the zones where we are getting more cases. And that needs lot of planning, lot of involvement, lot of manpower also to be needed, because we need to be a compassionate care for the areas and where we are doing the containment is being done. And that is one aspect. Otherwise, if it is a lockdown is done, it is relatively an easy option. The people will be forced to stay in the house. The breaking of the chain will be effective. So many of the associations, we feel a continuous lockdown, it's a full-blown lockdown will be necessary at this moment for breaking the chain. Not necessarily the lockdown is going to overcome the disease. It can only postpone the disease. But technically, We have a shortage. This has to be overcome. Bed has to be enhanced. Now the railway has come in to enhance the bed strength. All this preparation needs another 3-4 days, and this days is required for us to up and come out with very more positively to face the challenge and overcome the disease.
Fantastic. Fantastic. In fact, I have another doctor who was part of that meeting, Dr. Gitanjali Bhatmanabane. Doctor,